This is ASAP Pathway. Hello, welcome back, friends. I am bringing back the one and only Dr. Stasha Gominak today for a part 3. Hello, friend. How are you?
I'm good. Thanks for inviting me back.
Absolutely. We said last time we had to have a part 3, and who knows? I mean, this is just such an ever-changing, evolving topic that's really on fire in research right now, literature. More and more clinicians are coming to me and patients asking my advice on the microbiome, the gut sleep connection. I'm learning, you're learning. I love that you and I get to talk and learn together and have conversations. Sometimes we just talk about everything but sleep and life, just in general, which I love you for. But for the listener today, normally I do an introduction bio. So I want to reference, because I want to talk and get going. So I want to reference episode 35. You'll get the whole scoop on the brilliance that is Dr. Stasha Gominak and her background. She is a neurologist, I'll give you that. She's a neurologist who heavily has focused on sleep after working in private practice and seeing some interesting things about vitamin D, the B vitamins, and gut health and changes in life in her patients. I'm going to reference also episode 49. That was the most recent one, part 2. I'm going to do a little summation of that for the listener today so you kind of know a little bit. I hope you go back and listen to 35 and 49. But before we dive into today, we discussed last time who is really controlling who? Are we controlling this microbiome and the bugs, the bacteria, or are they controlling us? We did kind of a funny Last of Us reference with that, but it is kind of interesting when you think about it. The microbiome really is its own separate entity, its own separate organ. The bugs give us the desire for what to eat that feeds them the best. Then they create the micronutrients that we need to thrive. All of the B and D vitamins and the biochemicals that follow suit, they drive sleep health, thinking, behavior, and appetite. We did a little myth busting that, hey, if I just take a probiotic, my microbiome should be great. Unfortunately, it's not that easy. The literature doesn't support that. You literally could be just pooping out tons of money every month. You have to make sure that you have a good environment for bacterial growth with all the B vitamins and the D vitamin soup to sustain the growth of the probiotic, but also the future grandchildren and great grandchildren bacteria of those bug strains. Supplementation, like a lot of therapies we talked about, it has a honeymoon phase. So it can be great at first, and then we might start to see a decline over the next year or two because as we are getting those micronutrients up and better bugs, we get better sleep. As we get better sleep, we're using up more of those nutrients, and we might need a different concoction of different nutrients. So there's a lot to unwrap there. We talked a lot about poop and gas. So let's go. What are we talking about next? We told the listener last time we're going to focus more. You would like to talk more about fertility, pregnancy, and the infant, where this all starts. So let's go.
Okay, do you want to ask me questions or can I just jump
You
off?
just go. You just go. I don't
Okay.
even, you're too brilliant for me to ask questions. I'm like, I don't even know what to ask you.
One of the things that happened to me as a neurologist was when I fell into vitamin D by accident and realized that it might be linked to how well we sleep. The next question for me was, oh, there's so many things that have happened to the general public in the last 40 years that were not common when I was in medical school. And every single thing that has shown up more commonly, I began to wonder if those things were linked to vitamin D deficiency. Because in the middle 80s, we moved indoors. air conditioning, computers, sunscreen. Before that time, I was in medical school. One of the things that has become much more common in the last 40 years is infertility. And the mother, if she does become pregnant, having neonatal problems, prenatal, sorry, delivering too early. And we've gotten extremely good at keeping babies alive that are born at 27 weeks, 28 weeks. My grandson was born at 27 weeks. He's
Hmm.
about to graduate from high school. How is it that neonatology has developed to that point? Because the kids are there, they're here too early, and we're trying to keep them alive. So we learn about it. What if the population always carried their babies 40 weeks and never had a premature birth? We wouldn't get good at it. That's a different way to look at medicine because of my grandchild and all these other things that have been happening at the same time. I began to be very interested in whether or not vitamin D levels was related to infertility. And it turns out the OBGYN literature is full of articles that are 30 years old, 40 years old about how vitamin D affects ovulation. Now there's a full set of steps that if the vitamin D is low to your body, and keep it, always picture this through every single animal on this planet uses vitamin D that they make in their fur, that they lick their fur. That means it's not just humans. If the vitamin D is low, it means there's no sun because we get it from the sun. That means there's no food. That means if you can get through that span of time, like winter every year, that this chemical, especially in mammals, was set up so that we wouldn't have our baby in the middle of the winter, or that the bear would actually coordinate their delivery of their pups during the winter when they're in a den where they're not being predated by other animals and they can feed their pups milk. So there's a connection between fertility, metabolism, and sleep that has to do with hibernation. In the human, we now have articles that show that when your vitamin D level is low, there's what's called an anti-Müllerian factor that makes your eggs not develop. That means it inhibits ovulation every month. What would that look like? It looks like polycystic ovarian disease or ovarian syndrome, where you have an ovary that has multiple cysts
Yeah.
developing because they are halfway developed. What happens every month is there are different eggs competing to actually be the one that is loosed, the one that goes down the fallopian tube, and the one that is being found by the sperm. That means you develop polycystic ovarian syndrome. You may or may not know that you have that, but if you have heavy periods, irregular periods, very difficult periods, it's very likely that your vitamin D level is
Hmm.
low. That means we can start there and say this whole idea of polycystic ovarian syndrome has other things like metabolism and growing hair on your face. That the reason why you get overweight and have hair on your face is one, your estrogen isn't high enough to be normal feminization. Number two, your D is low enough that you've lost the normal microbiome. And now you're having all sorts of other things that are related to that, what Stacy referred to, that you want to eat more high calorie foods because the microbiome is saying, you know what? D is low. That means we're hibernating. That means we need to put on fat. You're being run by a winter microbiome. So polycystic ovarian syndrome really shows the beginning of this person is going to develop endometriosis. Why? Because D runs the fallopian tube and the movement of the egg down the fallopian tube, and probably the ciliary motion that helps the egg move down the fallopian tube properly. When the D is too low and the ciliary movement is not right, when you do menstruate, instead of the blood sloughing from the endometrial lining out the cervix where it's supposed to go, it actually has open tubes. If those open tubes are not fighting the endometrial tissue and pushing it down back into the uterus, then it's loosed into the abdominal cavity. Also, there is in parallel a problem with the immune system that's always there. That means the little fibroblasts that are supposed to repair that area, the mast cells that are supposed to go in, and the little white blood cells that are supposed to go in, find the endometrial tissue that's in the wrong place, eat it up, get rid of it. they are not doing their job properly either. So the next time you menstruate, there's endometrial tissue menstruating into your peritoneum, and that's what causes the pain. It's causing
Ugh.
terrible inflammation. So both polycystic ovarian syndrome and endometriosis are linked to having a low D. That means that whole area of medicine could be prevented just by doing studies that show that the D over 40 will prevent that. You know what? There are already studies that show that. They're in the OBGYN literature.
And now you're
Why does
saying
my
they're
OBG?
saying the D over 40.
All
Uh,
you have to do is have a D above 40 and maintain it over 40. Do your levels. Now, here's the problem. What you hear all the time is take a D of this dose. No. D is a hormone. You have
mhm.
to know what your level is. You have to, over a period of years, determine how much D you have to take, you personally, not anybody else. You cannot give recommendations about dosing unless you have levels. You are a unique human. You have a unique state of deficiency. You have to take a D, do a level, and then determine what dose you need in the winter and in the summer. And then this is on preparation to you being the perfect place to have a baby growing inside you. That means that you have to have a D level that's maintaining not only you, but now this fetus that's growing, that's developing. So this is the preparation. This is how we prevent infertility throughout the population. Those articles already exist.
Now,
Now,
just as before we go on, like there's someone listening now can like maybe they're early in their pregnancy or they're wanting so badly to get pregnant. They really need to. And I know we're going to talk too about how they can get more information. I know you have little clips and stuff like that for information on that moms can watch, practitioners can watch. So we'll talk about that later. But it's imperative to have not only for, the gut health to sustain a healthy pregnancy full term, but even for the mother's overall health, sleep, oxygenation for that baby to have the best outcome possible too. So you keep saying 40 and higher. And I just, in my talking to you, we've always kind of said that 60 to 80. So where do
okay,
you land? I know the literature's saying over 40, but where do you land on this number? And then we can keep going.
it is my view that in order to fix a sleep disorder, the first assumption is in order to get so screwed up that you have a sleep switches, your brain, the part that runs sleep, gets screwed up, you have to be D low and have lost your microbiome for several years, probably many years. Therefore, my claim that 60 to 80 is the right range for a vitamin D blood level to be to fix someone, to have someone realize that their sleep feels better is a different question than what if I don't have a sleep disorder? What if I just have irregular periods? What if I've been told I have endometriosis, but I don't feel like my sleep is wrong? If I'm in the early stages before I've been so goofed up for so long that I've developed a sleep disorder and need to talk to Stacy or Stasha, then we're really talking about a different thing, which is where were the D levels in hunter gatherers? What's the information we have about a normal population that still lives entirely outdoors? We do have data about that, and the average, which is not the full answer, but the average is in the 40s to low 50s for a whole population that's out hunter gathering in Africa or in South America, where they don't even have a hut that they go to. They're just under a tree. If
Wow.
you think of all the animals on the planet, all the animals that are designed to be above ground are designed to be in the sun. So what we've shown in terms of prospective trials in OBGYN and pediatrics is from a couple, a OBGYN and a PhD scientist that have done prospective trials, and their final endpoint for the trials was just keeping the D above 40 and are able to show that problems with endometriosis, problems with preeclampsia, the outcome for the baby, early delivery, carrying the baby to term are all dramatically decreased in a population. And all you have to do is do D levels regularly during the pregnancy and keep the D level above 40. That's really a different mindset. This is why I have videos about how to do the right sleep program in before you want to get pregnant, during pregnancy, and in your children. Because it turns out that in babies, when the mom has been my client during the pregnancy and her D level has been 60 to 80 during the whole pregnancy, the baby's level is in the 40s. And if
Ooh,
you try to supplement a baby who's had a mom that's kept her D up and corrected her microbiome, you can make that kid start waking up screaming in the middle of the night. So it appears to me that really all you have to do is treat the mom, get the mom to be 60 to 80. And this is again in someone who's had troubles, okay? And the person who just had their first pregnancy had no complications at all. We're making the assumption that, especially if her newborn sleeps through the night easily within 6 months, that means her levels were ideal, the way they should be. Keep in mind that humans were probably made to be able to have 14 or 15 kids.
duh.
I have clients that have come in who've had 14 children that are alive. They were living in
Wow.
northern Mexico, probably in a little hut that had dirt floors. Okay, that is the way we have lived for 300,000 years. That is the way all other animals live. Dirt floors, pop out babies every 2 years. And believe it or not, when she's telling me about those 14 kids, she's smiling. I mean, it's hard
Phew.
for me even to
I want
imagine.
to meet this lady.
Yeah, and she's seeing a neurologist because she's moved up north into Texas to live with her grown kids, but they live inside now. They didn't
Huh.
live inside because they didn't have electricity, they didn't have television. They lived outdoors because the climate is better. So she's in an ideal situation. And now, because of immunizations and antibiotics, her kids have lived to adulthood. Now, if you picture it in that way, that means not being able to have a single pregnancy and having a single pregnancy that's perfect, but mom is not actually filling up the deficiency she developed because she doesn't live outside. She puts on sunscreen. She doesn't fill up and fix the deficiency state she developed in the first pregnancy. Now, the second pregnancy is much rougher. By the third pregnancy, she has a kid with an autoimmune disease. She starts to have generalized joint pain. She starts to develop all sorts of problems. And every single client that I have that sees me for a sleep disorder, you go back and look at what their pregnancies happened during their pregnancies, and you can see her deficiency state through what happens to her and her child. So, in terms of what we're doing, what you and I are doing, Stacy, is we're fixing someone who's had their biology really ruined by the time we're doing something into child development. That means that they were on the wrong road. What would be better is to be on the right road before you get pregnant. Okay. Now, the next question is, how do I run what I'm going to do? Let's say I do Stasha's program of right sleep and I get my D level up to 60 to 80 and I sleep better. Okay. Supplements are just a tiny part of all the chemicals that your brain knows how to make so that you will sleep normally. You have to fix your microbiome as well, because the microbiome, as Stacy told us at the beginning, is a pivotal part of providing all of the B vitamins that your fetus requires. If you picture this out in the wild, there are no supplements. The supplements are really not coming from the food directly. You must have feeding the microbiome. The bacteria have to be the right kind in the right part of your belly. That depends on a D level from you, from your skin. So when you have the right microbiome, the microbiome supplies to your infant as soon as fertilization happens. All of the supplies for that growing infant in the first 12 weeks are being provided by your normal microbiome. We were not taking prenatal vitamins. Humans could
Right.
have 14 babies without prenatals because everything is supplied by nature normally in the right ratios. That means all of the major developmental problems of infants, of cleft lip, cleft palate, meningomyelocele, things that happen very early in development in the first 3 or 4 weeks have been traced back to B vitamin deficiency states. All of the increase in autism is being traced back to the improper supply of these pivotal things, such as the building blocks to make endocannabinoids, the
Mm,
building blocks to make other chemicals that we don't even know about yet that
yeah.
help the baby's brain develop normally and grow normally during the time that the baby is in utero and after the baby is born. because the mom's microbiome is still sending chemicals in the breast milk that are supposed to go to the baby. So the baby's still developing. Our babies don't pop out and walk, okay? Guinea pigs come out fully furred, able to run around and eat normal food. That means they've spent enough time in the uterus to come out and survive. Our babies are still developing, even
Yes.
for into 5, 6, 7, 10 years. Brain development is still happening. That is relying in the first 2 years on mom's breast milk. That means mom's microbiome needs to be normal. Her D level needs to be normal, and the baby needs to be in the sun. So there are all these very old articles that show that women who carried their baby on their back out into the fields because there wasn't any other thing to do with them have a better survival. Their babies develop better, they fight infection better. The recent COVID epidemic showed that the babies that were being carried on the back of the women who are the poorest in India actually survived COVID better and developed better. So we have actual events that are still showing us living outdoors is the way humans were meant to be. So there are individual tapes that talk about if you are not pregnant now, but you want to make your body perfect to receive. And by the way, if you're not ready to get pregnant, you better be on birth control because I have several incidences of teenage pregnancies. Once the kid is brought in for their sleep disorder, we start to do right sleep. And I say, those teenage boys are stupid and gross. But as
They're
soon as you
stupid
start
and
doing this,
gross.
as soon as you start doing this program, they are going to look so cute.
They
And you
get
are going to
less
feel a
gross.
desire towards them that you have not felt before. Okay, I'm just
Yeah.
warning you. If it hasn't happened now, it will. And then they come back 3 months later and they're pregnant. And the mom is saying, oh my God, these are biologic things that are supposed to happen at 16 years old because that is really the easiest time to get pregnant and have a baby. Now, whether you want to do that then is a separate decision, and you are living in an age where you can make a decision about that, ignoring our current politics. That means anybody who just had a baby who wants to do this, I don't care that you're still in breastfeeding. You can get pregnant again. If your D goes over 40, you're going to start ovulating and you will get pregnant again. Same thing. Another dentist client of mine wasn't finished breastfeeding the second kid. And I said, are you on birth control? No, I don't think I need it. And sure enough, there she's pregnant. My next visit with her 6 weeks later, she's pregnant again. So fertility is directly linked to the D level. The second piece is your body has to be giving everything that the baby needs. It's very interesting that most of the other countries that are highly developed, Australia and Norway, the infertility experts are giving prenatals that have much higher levels of B's in them. They don't
Hmm.
quite get the connection for why they need higher doses, but they're having more success with that. That means we need to get the right microbiome back. It was meant to be there for you to be able to support this baby. So there are a set of videos that are how to use right sleep before you're pregnant. Then there's a set of videos of once I get pregnant, what do I do then? Okay. I want to reassure you that when you take B50, which is the preparation that right sleep uses, B50 means B vitamins in a bigger dose. That group of bees would have been supplied by your microbiome into your bloodstream, and that bloodstream would have then supplied your baby through the placenta. So it is safe to take B50 while you're pregnant. And I've seen many pregnancies go all the way through to full 40 weeks. And it is also safe for you to have a D level depending on what your body needs, either over 40 or in 60 to 80 if you have developed a sleep
Sleep
disorder.
issue. Hmm.
You will know when the D level is right for you. Now, if you're somebody who's always had a sleep problem and this is your first pregnancy and you know your D has been profoundly low and you've had allergies, asthma, sleep disorder since you were a teenager, terrible pregnancy, that means you've had a low D for 30 years as you're entering this pregnancy. Then 60 to 80 is the
Is
right
what
place
you're
to
gonna go.
be.
That makes sense. It makes sense. Like for
Yeah.
you to have, for your sleep to be affected, you have been so deficient for so long. Or if you're a kid, oh my gosh, maybe you've never had the right, it's just never been
Yes.
right, which was the case with my kids. They just never had good D levels. It's not like they were great, then they got bad somehow. They just never had good levels because I never had good levels when I was pregnant with them. So,
Right.
and it's interesting that you talk about these, like kind of a warning of things to come, like, hey, these boys, they don't look super attractive right now, but they're going to become more attractive. And this may not be, this might be a little bit of a topic that might, be a little bit, what's the word I'm looking for? Uh, what's the word I'm looking for? I'm searching. Uh,
Challenging.
Challenging. That's a really good word to describe it. But you have had, since we're on the topic of sex hormones and pregnancy and, sex drive and things like that, you have had situations where kiddos came in with like delayed, periods, delayed puberty, and they start getting the D levels into that plus 40 area, and things kick in right away. You've had adults that kind of felt like blah, they weren't really sure kind of how they even identified, and have had situations, not all, I'm not painting a broad brush that this goes for everybody, but it is interesting that these are things you have seen in your clinic where, or, in your practice where somebody may not have sexually felt one way or another. They get their vitamin D levels up, B levels start normalizing, gut health improves. We start seeing changes in sex hormone production, and then the patient is reporting back to you anecdotally, hey, because they were there for whatever, sleep health, what have you, and they're telling you they're feeling different. They feel a little bit more like they're belonging, in a certain mindset. Um, so, I mean, it's just biology. I mean, it's just science, and that's all we're saying is
Yeah,
just
biology has been highly politicized in a way that it shouldn't be.
right.
It's important to know that sex, your decision about which sex you are is really run by the sexualization of your brain. You are born with a specific genetic makeup, but the brain is sexualized every night while you're sleeping. And that
Yes,
is what normal development is about. It doesn't end when the baby pops out and has a certain genitalia. It's not about that. It
correct.
is
I mean,
sexual
this is why you
behaviors.
hear women that are like, I went from having this crazy drive for my husband and, or whatever, men will say it, and then they just feel like nothing. They feel
Yeah.
like they don't have anything. It's like sex is the last thing on their mind. And you can imagine in someone growing up going, wait a minute, my friends are feeling this way. Why am I not feeling this way? Um, that there could be some potential sex hormone issues that we should dive into. Like you said, we're at the mercy, our brains are at the mercy of the hormones they are bathed in.
Yes, and if you don't sleep, it doesn't happen. I
Yeah.
warned the boys, the teenage boys, when we're coming in for headaches or whatever, that when we start this, they're going to start to have more erections in the middle of the night. They're going to start to have wet dreams that they never had before, and those are not things that you'll tell your mom about.
Right.
And in the current environment with so much internet information, it's kind of scary if you didn't know that that was going to happen to you if it comes on all the time.
Yes. Or if it should be happening and it's not happening to you and you're embarrassed because all your buddies are talking about how that is happening to them, and you might be a teen boy that isn't happening to you. And so, it really is. There's just a lot of information, a lot of data and information floating around, and it can be harmful to someone questioning things. But back to it's really interesting because I kind of reverse engineered my practice. I started seeing these adult patients that couldn't sleep, couldn't tolerate CPAP, started mandibular advancement device therapy, started there. And then you start reverse engineering everything. Could I have gotten to this patient? There's so many craniofacial hiccups here. Could they be breathing better? Could they be sleeping better? So then we start getting into the kids, right? oh my gosh, these kids, we're seeing growth and development issues. Which came first? It's like the chicken or the egg. Are they breathing bad because their craniofacial bones aren't developing like they should because they're not eating properly? Or were they not breathing properly? The tongue dropped down and now the face is, it's like it's all in woven. Well, then, okay, let's back up even more. Why aren't these kids breathing properly? We're not eating the foods we shouldn't be, or we're not eating the foods we should be. They're not chewing like our ancestors used to chew to develop the face, but they're developing allergies and they can't breathe through their noses at such a young age. So, I mean, I just keep finding myself going back further and further in the airway sleep time machine. And it's getting to the point where most of us in pediatrics, sleep and airway health, like Kevin Boyd and all these other amazing people out there, it's down to, okay, let's get to the womb here. We can start seeing things in the womb, even in ultrasounds, and we can see that babies aren't necessarily doing the things they should be doing in utero, and what is happening in the womb that they're coming out with such propensity to mouth breathing or low tone or poor sleep, and that's where we're at. It's this topic right here of, and listen, mom, the moms listening, there's plenty of moms listening right now. Enough of the mom guilt, okay? We're all doing the best we can. Man, if I could go back in time with my three kids, I would have done this so differently. Wish I would have known Stasha 23 years ago, but I didn't. So, you start somewhere with the knowledge you have. But if you are someone right now that's listening and you're contemplating getting pregnant and starting a family, I highly, highly recommend, just from this mother here. I just wish I had done this stuff. All my babies, when I tested them, by the time I figured this out, were within 1 point of my vitamin D level, or exactly what my vitamin D level was, which was 22. All three of my kids, 21, 20, 22. My vitamin D was 22 when I tested. So it's just so interesting. And when I look at my babies, I had them all 2 years and 4 months apart, not planned that way. It just was 2 years and 4 months, 2 years and 4 months. And my youngest, I was probably the most depleted of my D health and gut health. I'm really ultimately gut health issues. And he has the worst issues with acid reflux. He has had the worst issues with allergies. My older two, not so much. But the youngest one, which you told me, it's usually that, if you're like boom, 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 it's usually that third one. So we're just seeing a lot. And acid reflux exacerbates sleep-related breathing disorders because it inflames all of the tissue. It can even get up to, nasopharynx level. Larynx can be hypertrophied from acid inflammation. So it's like the chicken or the egg with sleep-related breathing and acid reflux. And all of this comes down to, we look at vitamin D and vitamin D receptors and microbiome health. So it's super important what you're talking about, this topic. I mean, we talk about kids' health and intervening, but man, what if you can get to that baby in utero?
Okay, let me just attach that then to one. I'm really speaking about safety because one of the big problems, if you have an OBGYN who is not thinking this way, then you're doing something that's in conflict with your doctor, which is not a comfortable place to be. Some of them are not even interested in supplements, but in a general sense, then you have to educate yourself. And the literature is there for the OBGYNs that are interested. So let's say you've gone through your pregnancy now. The next decision is, what should I do while I'm breastfeeding? So let's say, and I have lots of other examples in my own family and other people of what happens if you keep your D level up into the 60 range because you were someone that's either getting pregnant in your late 20s, early 30s, early 40s, and you know that you've had a long-term D deficiency, then you're going to keep your level 60 to 80. You're going to keep your level 60, 80 while you're breastfeeding your infant. So that is a totally different thing than what people are doing now. They're suggesting vitamin D supplementation. If you've done the right sleep program during your pregnancy, you do not need to do desupplementation with your baby if you're breastfeeding. When you're transitioning from breastfeeding to solid foods, then you will need to start paying attention. And the way that you do that in infants is not by drawing blood and doing blood levels. I don't want any little kids to have their blood drawn. The way you measure what's going on in your baby is by watching how they're doing. Do they fall asleep? By 6 months, they should be sleeping through the night, not waking up and screaming at night. They should be happy when they wake up. They should be napping appropriately for their age. And kids that never nap, kids that never sleep, have profound vitamin D deficiencies and problems with their microbiome as well. This is not even talking about brain development and the increasing wave of autism. So, in the background, even kids who are developmentally normal, you're watching their sleep and deciding what you're going to do with your D dose, depending on summer, winter. There are videos and handouts on my website that help you go through these three special situations. There are also a set of videos that are about how to use right sleep in your child. So if we transition then from a 1-year-old, 2-year-old, now we're going into toddler. Clearly, they do not need the amount of supplements that an adult needs if we're going to talk about supplements as a way to bring back their microbiome. Their little tube is much smaller than ours. Their body is smaller. So there are smaller doses. If you've started this or you're hearing this and you are, for instance, trying to get in your second pregnancy, but you have a 2-year-old now, then you're going to be looking at your 2-year-old in a slightly different way. And that is supported by these videos that are age dependent, how to use right sleep depending on the age of your child and what you've seen in their development. I also don't actually recommend that any child who's been sleeping normally, which means they wake up happy most of the time, anywhere from maybe 2 years old to about 11, they ought to be falling asleep easily between 7 p.m. and 9 p.m. as they get towards 11 years old, and they sleep all the way through. They don't wake up. They don't ask for a glass of water. They aren't up roaming around the house. They sleep all the way through, wake up at 6 in a good mood, no pain, no medical problems. That child is really not needing D supplementation. That child is showing a normal development, normal status. It means that vitamin D is not necessarily for every single person. You need to know what the clinical presentation of that kid is. And then in children over 5, then we do D levels and we dose based on these additional videos that I've given you to help you with that.
So on the topic of, this is great. What should good sleep look like in a child? Since you're saying, 4 years old and younger, you're going by basically presentation, sleep presentation. And so there's that question I have, like things, I get this a lot. I'll ask how their child sleeps. Is the bed, when, you put him to sleep with a nice, the sheets are folded down, they crawl into bed. Does the bed look like a tornado in the morning hit it? Are the sheets all over the place? Are they constantly tossing and turning? They may be staying in bed, but when you peek in on them, and please, parents, check on your kids while they're sleeping. That 8, 9, 10, 11 hours of a child sleeping at night, that's a third of their life. And you really should have an awareness of that. How some people have cameras, for whatever, security systems, like flip it on, check on your kid, make sure that, that they're not in these crazy, weird positions. But I hear this a lot. Well, they sleep good, but they get up every single night. And either one of the few, they'll get up and come get me, and then I'll put them back in bed, and then they're fine. I get that a lot. They just get up once a night. They come into my room, I put them back in bed, and then they're fine. Or I'll hear they get up, they have to come in bed with me, or they won't go back to sleep. Or I hear they get up and, we've got sleepwalking. Or no, they stay in bed, but the sheets do look crazy. So, my mind is going, Okay. I know sleep-related breathing issues can cause restless sleep. But I also know restless sleep syndrome, ferritin issues, different can be causing some restless leg syndrome or periodic limb movements, things like that. So for the parent listening, that's like, what the heck should good sleep look like for an age range, birth to 6 months? So do you have kind of a nice
Yes.
layout for
And
that?
and that's extremely appropriate to ask about that because we have a new normal that you establish by talking to your pediatrician and your friends while you're at the supermarket. And your friends' kids are running around like insane all through the supermarket. Your kid is, blowing out snot because they've had their third cold. This is the new normal. That
Yes.
means you think that their sleep is normal. The comparison between when I was growing up and in my early training in medical school, your kid falls asleep in the in their child seat in the car, you pick them up and take them to bed. They don't wake up. That was normal back then, and that is really normal. And we have to make the claim that we know that you get paralyzed in the deepest phases of sleep during which kids develop their brain and grow. That means this movement during sleep is abnormal. We are all designed as animals to get paralyzed. Our brain paralyzes our muscles during sleep. That's really part of why kids get sleep apnea. It is not just about the size of the tube. It is also about how is the brain doing in keeping the paralysis perfect. So even if the tube is big enough, if we paralyze the muscles surrounding that tube that we breathe through too much, then apnea can occur. And if you can picture that there's a set of cells that are given the responsibility of paralyzing your child perfectly, that's a hard job. That means if those cells are just kind of not supplied with the basic ingredients they need, then it starts to wobble a little bit. So you
Mm.
frequently see too much movement accompanied by sleep apnea because you're getting too paralyzed at certain phases, not paralyzed enough in other phases. You have to picture it through the lens of we were perfectly designed to be living outdoors and to sleep. All the animals sleep and get paralyzed, all of them. That means we're the ones that are actually suffering because we listened to the dermatologist and because of social things that have happened since then. We have this incredibly luxurious life like French kings. We are
Yes.
living inside. We don't have to do anything outdoors. We don't have to go out and dig in the dirt. Now, then in the background, how do I know? This is another really important question. Every single child is unique. And how do I know whether or not this is normal for Max? Is this normal for Stephanie? Is this we're pushing so much that each child has their unique things. And the pediatricians that you're seeing, they're not 7 years old or they'd be out of practice now. That means they have only seen the new normal. So
Oh,
it's
so true.
normal for their kids to wake up. My friend who had 5 miscarriages before she finally got pregnant, her first child did not sleep for the first 2 months. Actually, he slept for like 2 weeks. And then for 2 months, he didn't sleep. He just cried for 2 months. And what did her pediatrician say? You have a colicky baby. Colicky was the name of rickets, which then was described as vitamin D deficiency, finally. That means that literature exists for that pediatrician, but medicine is being told that they shouldn't pay attention to vitamins. Vitamins are dangerous, they're for crazy people. That means that child that didn't sleep for 2 months had problems because of that that could have been helped just by getting mom's D level better, giving that kid some vitamin D at that time. There are good descriptions of this in the literature. It's about how medicine is being educated regarding the vitamin word, because vitamins are not for physicians anymore. There's a
Yeah.
big problem in medicine, pediatrics. There's a big fight going on in the background between different factions that believe that we could prevent a huge amount of disease and struggle and poor development and anger and mood and suicide in teenagers and little kids and child killing. I mean, what?
Yes. I mean, someone just posted the other day, hey, look at all these these people that have gone off the rails and do mass shootings, and a lot of them look the same. A lot of them have the same, they look exhausted. A lot of them have similar craniofacial issues. And that's not a coincidence, folks.
No, it's not a
That
coincidence.
is
There's a
not a
neurochemistry.
coincidence.
My guinea pig, we have guinea pigs. My guinea pig was just introduced to another baby guinea pig because he was fighting with the other male. Well, gee, is it normal for males to fight each other? Yeah.
Huh?
Is that a big thing about male humans? He's introduced to this baby guinea pig, a little male guinea pig, and he goes completely berserk and starts to mother this guinea pig. You have to picture that every single set of animals, even a dog will, unfortunately, sometimes they'll eat a guinea pig, but most of the time they'll just like, if it's a female, they'll mother that guinea pig. There is a neurochemistry behind us looking at this little thing and saying, oh, isn't that cute? And wanting to protect it and mother
Yeah,
it. In order to destroy that neurochemistry that made these different species survive on the planet, you have to do something really messed up in the brain because that was one of the major survival things to be able to protect newborns within your tribe. That means there's something neurochemically happening. It's true that you have to have the automatic weapon, but to have the stimulus to go and actually plan that and do that,
correct.
you
That
have to
is
have a level of anger against these fragile things. That's not normal neurochemistry, in my view.
correct. Correct. Something I wanted to bring up, I'm curious about. I know that, we're seeing a rise of autism. I mean, there's so many papers out with the connection of autism, gut health, so many.
Autism, gut health, and sleep, they're
And
always
sleep and
together.
sleep. And the fact that children with autism struggle more with sleep, getting to sleep, maintaining sleep. So, on the topic of that, is there anything that you do differently in your protocols if you know someone has autism or the child has autism? Is it the same protocol, or do you find that you have to tweak things a little bit?
It is not the same protocol. And you referred to it without realizing it, but you said if a child started with allergies, asthma, mouth breathing at the beginning, they've had trouble since the beginning.
Yeah.
In the person who is born to a mom who has very low B's because the microbiome is wrong and very low D, that child's biology has formed around a different supply and has to cope. If that child is going to stay alive, it is my experience that their biology actually makes what are called workaround pathways. They use a different pathway.
Mm,
What that ends up meaning is if you try to give these supplements in doses that other people use, and there is a routine dose that's addressed in my workbook, but I'm always telling you, you have to modify what you do based on what your body tells you. It is common in little kids and in adults who've been sick forever that they cannot tolerate a large D dose. Their D level may be 10, but they can't tolerate the dose to get them up. As a sample, I had a client who was 18, never started menstruating, never was able to gain weight, otherwise completely normal intellectually, but weak and never able to physically do athletics. And her D level was profoundly low. She's from Canada. She could never tolerate a D level that would have puffed her dose up. It took a year to slowly increase her D level all the way up to where we could actually get to 40. It took a year and a half to 2 years to get her up to a D level that would get her level up to 60. Now, in the meantime, every time she tries to increase, she gets answers from her body like her heart rate goes up, she doesn't feel right, she feels awful. Those sorts of signs suggest that she can't take that dose now. What we've been trained is she must have a genetic difference, that we all pop out exactly the same. Well, that's not really true. It turns out our genetics were based around living outdoors. That means there was a basic amount of D that was being made based on your skin type and where you were on the planet and how much sun you're going to receive. That has developed over hundreds of thousands of years. Then we pick people up and we move dark people into low sun environments, and we don't pay attention to that. And then the dermatologists tell us to stay out of the sun, and then we don't farm anymore. So now we have a situation where the biology originally was meant to have a certain amount of bacteria. Those bacteria are not genetically ours. They come from outside.
Right.
That means they've been on the planet for 500 billion years. They were already doing their thing. So the one thing you can assume is our biology came second to the bacteria's biology. That means that everybody was really designed to eventually have a normal microbiome. Okay. Now that's eventually. Also, in someone like that gal who's, I'm increasing the D, you can't add, even though she's 18, you can't add B50. Her biology is, her nervous system is not going to be able to tolerate B50. That means in an autistic child, the problem with sleep, the problem with the belly is still there. You have to start very, very small doses, and you have to do what that child will tolerate. And what you watch for is anything that I do in terms of supplementation, and they are low in a million different things: iron, sulfur, all the minerals, all the things that the bacteria were supposed to help us to incorporate into our biology. They are low in many things, and you have to add one thing at a time and watch what the sleep does. And if you keep watching the sleep and the sleep is either the same or better and doesn't get worse, then you say, okay, we're okay with that dose. It is a very long undertaking. It is a totally different way of thinking about this. You must move these supplements. This idea that there is a minimum recommended dose for each person is complete fantasy. It is absolutely wrong. You have to see what that person does in response to that. And the one good thing about kids with autism is by the time you make that diagnosis, there's a mom or a dad or both of them that are there that are constantly are supervising. So they're really, to some extent, part of your body. So you will always see, can they eat? Can they sleep? That you are watching those outcomes as you add these supplements with the idea that eventually that child will actually get back to having a normal microbiome, and their nervous system will then put up with the production of that normal microbiome. It takes a really different way of thinking about supplements, that supplements are a crutch on the way to achieving this particular space, which is they're sleeping better, they have no complaints, they can eat more things. There's so many pieces of the information now that are available to us. There's studies that show that if you change the D supply to a mouse, the mouse's microbiome makeup changes, certain bacteria die off, and
Mm.
those bacteria are making the building blocks that become the endocannabinoids. Those bacteria, other bacteria are making certain things that make our preferences, our food preferences, one of the things you referred to. We now have the basic biochemistry, and we now have articles that show there's a certain bacteria that makes B5 that then goes in and hits a receptor on the lining of the colon that then tells your brain whether or not you want to eat sugar or fat. And it traces the entire hormonal pathway to that. That means your child with autism, the other two things that are very common are that they have a very small preference range for what they'll eat.
That's
Both the
exactly where
texture
I was going to go
and the
next.
taste. The
Yes.
texture and the taste is very limited.
A lot of
Their
food
physical,
aversions. Yeah.
yes, their physical experience of clothing touching them.
Hmm.
They experience light moving touch. You know, we pet animals, we pet our kids. This is usually experienced in humans as pleasant. In them, it's experienced as unpleasant. In that same experiment with the mice, this particularly brilliant Francesca Guida that set this up measured the response of the spinal cord cells to light moving touch on these mice and showed that the actual sensation, the development of sensation in the spinal cord in the brain was not normal.
Hmm.
And it's reversible. I will claim that the
Okay.
brain knows how to develop normally. And I've seen that only in 2 or 3 kids, but I've seen that in very developmentally delayed kids where when they start to sleep, the two parts that must be there, a normal microbiome and sleeping. But the brain remembers everything it's supposed to do. It doesn't just do it while they're in utero. It keeps all these little steps that it was supposed to do. That means even in a 20-year-old, you might actually be able to see these things slowly changing over time. I
Well,
have a client who's very ill herself, but has 3 very profoundly developmentally delayed adult children.
hmm,
And she's doing right sleep. She's really smart and she really understands the time frame in which you see this. The importance is nothing happens in response to any primary building block, even the ones made by the microbiome, unless you get into the phase where those building blocks are being used by the brain to do the development. So you don't get to see the outcome until the sleep is actually being
actually
successful.
being,
And it moves by tiny little increments, like 2 months to do to learn a single word, to go from nonverbal to a high.
that's where I was going to go to, is because what in ASAP we talk about this. There's just a lot of, unfortunately, good intention, bad information out there. And, there's some companies that'll say, if you do this and put this device in, you get rid of bedwetting goes away. ADD is reversed, all these things. And I'm like, oh, you know, over promising, under delivering, giving up, getting the parents' hopes up that just things can just be magically better. If now, well, what I have seen is especially like with ADD, ADHD, and I punt to Stephen Sheldon. He is a sleep physician at Lurie Children's Hospital in Chicago. But he's talked about, if you don't fix some of this stuff neurologically by 6, some of that's just hardwired and it's done. Okay. So you want to get to these kids as early as possible, the best neuroplasticity. But we also know we're learning more and more just how neuroplastic the brain is throughout life, even more than we thought it was. And I don't, again, I'm not a neurologist. I don't know in what facets it's more neuroplastic and it's not in other facets. So for the parent listening who has a child on the spectrum, um, so when you start making these changes and you say you have seen some changes, because the gut microbiome is improving, tastes are changing, micronutrients are now changing, food aversions are changing. We're seeing better neurochemistry and building blocks can be improved. Is there kind of an age where you're like, okay, higher hopes here, less higher hopes of change here, maybe minor? After this age group, you're not going to see much change. You'll see some, but don't get what are we expecting here with a child on the
I,
spectrum?
this is a really important way to ask that question. I was trained as a neurologist in the late 70s, early 80s, and we were trained that somebody who's already 18 years old is static, meaning they won't get any better. Okay, their development is finished and they won't get any better. So whatever developmental stage, and when we have kids that are not achieving certain milestones, we put them at a certain age level and say they're at a 6-year-old level. Okay, they might be 16, but they're at a 6-year-old level in reading and development and verbal skills and physical skills. And then we grade each one of those different categories at different ages, perhaps. Now, I was trained to believe that. And then I got into sleep. And then I got into this vitamin stuff. And then I realized that I was not asking my mom, who had an 18-year-old developmentally delayed kid who had uncontrolled epilepsy. And I was not really thinking about D or his sleep. I was really putting it into my adult practice and left them for last. And it turns out Wesley had never slept during the night. And when I started to ask mom questions about that, she'd say he'd always be awake at 4 a.m. if I'd go in there. He was the third kid to a very dark-skinned African American woman. He walks funny, he's nonverbal. She can sort of understand him a little bit, but I can't. And he has to wear a helmet because he has seizures all the time.
Hmm.
And over the period of time that I'm caring for him, then his seizures get better. And part of the problem is when you're using these seizure medicines, they delay everything. They just make them stupid. And if you're not thinking about sleep, you don't really address those issues. And then by the time I leave practice, where I'm about 5 years into giving that kid D, he was on 20,000 IUs a day for 5 years. He was
Whoa.
18, and every time she would come back in, he was doing fine. He didn't have seizures anymore. So mom didn't want to waste the time coming in to see me. It's she has to get out of work, she has to bring Wesley in, etc. But I'm saying you must not be giving it because his level is now 38. Okay, he's been on 20,000 a day for 3 years, and his level's still 28. And she says, "No, I'm giving it every day." And I have her bring in the bottles and everything. By the time I leave practice, Wesley is coming in with a cowboy hat. He's got a little goatee. I can start to understand what he's saying, and he's making jokes. And I'm like, Mom, I feel
Like, who
like
is this kid?
I feel like I can understand him. She says, "Oh yeah, he's completely different. He's learning to start to read." Now, that challenges what I was taught, okay? This is where I come up with the idea that if you get them sleeping, the sleep is the key, not the vitamins, not the sleeping pills.
Correct,
The
correct.
sleep is the key. Whatever works for that kid at that time, that means that's what the brain is needing, and then it will change what it needs. But that means that I enter this in adults. I enter this in adults who are very sick. 32 years old, had a twin pregnancy, and is a wreck. She's now 100 pounds overweight. She's got epilepsy now. She has daily headache. She's been told she has rheumatoid arthritis. How did she go from being a normal person when she was 20 to this mess? Okay. If you don't picture that you can actually turn back the clock, not me, not the doctor is not in power. The brain knows what
Right,
to do to
right.
make a normal 20-year-old. It already did that once. It can turn it back. How does it do that? It does that while she's sleeping. That means I believe that if you have a child that is still at an infant stage of 6 months, and if they don't have a genetic disorder that has shown that they will never develop more than that, and even if they do have a genetic disorder, this comes up all the time in trisomy 21. The current pediatrician is treating trisomy 21 as though they have a shortened lifespan and they get sick a lot. Because what we've done is taken trisomy 21. I grew up with kids in my school that had trisomy 21. They can go to high school with us. What I saw as their possibility during the phase when we were putting kids who are developmentally different in normal school was that they can live to be 50 years old. Now you're superimposing D deficiency and poor sleep on top of those kids, and they die really early, and they have a million other complications. And when you take them in to the hospital, this is from my clients, take them into the hospital, they just go, "Oh, they're trisomy 21. They're going to die soon." They just treat them as though. So, one, if you do have a genetic diagnosis, you still don't know what the best your child could achieve. You really don't know. In almost every genetic diagnosis, there is a range of outcomes. That means you have someone who, let's say you have a child who has developmental delay and they don't have a genetic diagnosis. We should always picture that if we can get things better in the microbiome, if we can make them sleep better, we don't know what their potential is. If you don't picture that their potential is to go to college, then you will never head in that direction. You will never keep trying until you arrive there.
It's
So
so true. It's
I
so
have to
true.
give a shout out to this gal who's my client now, who has basically educated herself in biochemistry because she's getting so much better, and her three kids that are still profoundly delayed, she is determined that she's going to see how much better they can get. And she has kids that were nonverbal that are starting to be verbal, that are 20 years old.
It's so true. I love what you said, um, that you just don't want to cut off the potential of any human being. How many stories have we heard where someone said, "Oh, they have, a spinal injury. That's it. They're done for," and sometimes there's just horrible situations where there is no improvement. But we hear it a lot that now, look at them now. They're walking, they're running again. I mean, you would have never thought that you just have to try not to give your hopes up so much and be optimistic at the same time and just like, what if? Let me give you the best outcome possible. Let me give you the best diet, sleep scenarios to see what your brain is capable of doing because every brain is different. My best friend's youngest son has Down syndrome, trisomy 21, and she just, the doctors would say, "Oh, he'll probably this, he'll probably that." No, I mean, she talked to him like the other two kids. She pushed him like the other two kids. And the older siblings highly involved in his life. That kid, I mean, I have the best conversations with Dawson. I mean, he is hilarious. And it's just interesting because I watched my friend and she worked so hard with him and pushed and just didn't say, he's got trisomy 21. I guess he's not going to speak like everybody else. And yes, there are delays. And yes, there are anomalies, but he is crazy fun and just so
Yeah, you
amazing.
won't learn things unless you're asked to learn them. You can
Exactly.
see
And
this in
and push
in
them.
your kids, your own
Yes.
kids. If you
You
do
got to
everything
push
for
them.
them, they won't know how to do anything.
The brain needs to be challenged. I was actually listening to a book called The Source. It's my most recent book. She's a neuroscientist. Actually, I think she's a psychiatrist and went into neuroscience, but she was pushing the boundaries of, like wanted to look at manifesting your life from a biological perspective instead of a spiritual perspective. That there really is a reason that people that think a certain way have amazing lives. And she's like, let's get the spiritual aspect out. Let's just talk about the brain. But she was talking about the challenge the brain needs. She's even improved her eyesight by not, doing certain activities to challenge the brain to rise to the occasion. The brain likes a challenge. You got to push it and challenge it to create those neural pathways. We got to go, but I got to ask my questions at the end. But well, I'm sure we're going to need a part four.
Can I tell one more story?
Huh?
Can I tell one more
You
story?
go right ahead.
It hooks up with two separate things, which is in medicine, at the same time that I'm seeing these patients as outpatients, Wesley, that I was telling you about, I'm seeing patients who are in the rehab facility or in the part of the hospital that sort of they're never going to get better. Okay,
Yeah,
I don't know what they call it different things, but
right.
they're never going to get better. And when I would be called to consult, I would be the only person doing their D levels. And invariably, that person has been they're never going to get better part of the hospital for 6 months, and their D would be like under 10.
Mm,
And if you start giving them D and you start giving them these microbiome producing Bs, and you do that on top, the people with chronic infection, the people who've had a brain injury that have never gotten better, you have not given the brain what it needs to be able to sleep, to help you as a physician make the body better. Physicians do not heal the body. We stand around and we put in tube feeding and then we watch what happens, really. So unfortunately, this piece also can have huge effect on people who have chronic injury. I had one patient who had this autoimmune disease that took out all the myelin in her head. She became comatose over a period of 3 days. And the MRI showed these big white areas. And this is a sample of what we've done in mice to reproduce MS, but it's not exactly MS. It happened dramatically. And it's an autoimmune disease and it looks horrible. And she had just gotten married, and her husband, just newly married, stood by her side for a year. And I was the neurologist following her, and I'm obviously not seeing her for a whole year, but I would say, and this was before I got into D and sleep, but the brain knows how to heal this, and it's an autoimmune disease. So when it gets better, she will lay down new myelin. And a year later, I ran into them in the rehab hospital. She's in a wheelchair. Her husband recognized me. I would never have recognized her. But she went from being comatose for like 6 months to And then there's an important distinction there because the actual neurons, the thinkers, were not injured. It was just the conduits, the sort of the rubber that's around the little wires in the
Mhm.
wall. And he recognized me, and I was like, oh my God, it's whatever, it's her. That means that every single person who's also had severe injury needs to have someone on their case that's saying, what was their sleep like before? Can we maximize their sleep while they're in the hospital to actually have the body cooperating with what we want, which is for them to get better?
Yes, that's well said. It's you have to be an advocate for your family, for your health,
For
on
your own health.
for
And,
your
and
own
there's
health. I
no way you're
mean,
going to get around that.
yeah, and I say to patients, look, I mean, your doctor, your physician, whoever your primary care is, they're really doing the best they can with the information they have, and you're just going to have to be an advocate for your own health. And, I'd love to help be a partner with you, and we could maybe co-educate your doctors and see if they want to get on this train and help you out. But if you get hit, if you hit the wall, you're going to have to go find another healthcare provider to help you on your journey. Thank you. Thank you always for sharing your knowledge, your experience, your stories, and wisdom with everybody, with the listener, with me. I learned so much from you. I feel you're so humble with, you know, um, bringing this information and saying, look, we don't know everything, right? But this is what I know. This is where I'm at. I mean, even where we're at right now, Stasha, I don't think 4 or 5 years ago we were even, you know, thinking the same exact way. I mean, it's like
No, we learn new things all the time.
we're
It's a
learning
very
new things.
exciting place.
It is an exciting place to be. It's an exciting, uh, and it really is an exciting time to be a healthcare provider. And I think the patients, it's an exciting time too. I mean, I know they're inundated with data and information. It can be overwhelming, but that's what we're trying to do with ASAP is kind of get some of the
Exactly. You're
noise.
educating people.
We're
Anybody who's
trying.
listening to this is educating themselves.
They're educating themselves, and we're trying to get some of the noise out of the way and help people navigate their own health better. All right, I'm going to end with my 3 questions, friend. All right, here we go. Let's see. What is your go-to I want to feel better snack? Like, I
Hmm.
just want to feel better right now. I'm going to go in the pantry. I'm going to grab what?
I can't grab it out of the pantry. It's
Or,
pizza,
ooh, pizza. So
pepperoni pizza.
that's
It's the
okay. Thin crust, thick crust,
thin, well, in between.
like a
I don't
regular
like the thin
crust.
crust and I don't like the thick crust. I like the one in between.
Okay, no Chicago. St. Louis style is paper thin, like a cardboard thin.
No, don't like
You
that
like
either.
you like the
In between.
in
Little
between. Okay.
chewy. Want it to be a little chewy. My husband has actually built a pizza oven in our backyard. He makes
Oh,
excellent pizza. He's gotten
yum.
very good with the dough.
If I ever come and visit you in Texas, I'm gonna have you make me a pizza in that pizza oven.
Okay.
Okay. Do you have a pet peeve? And if so, what is it?
Hmm.
Something that drives you kind of like, I can't stand when somebody
People who
does
throw their stuff on the ground and don't put it in a garbage can.
litter bugs.
Yes.
I hate that too. You know what's crazy that you're bringing that up? I was driving home from work Wednesday and I was passing a guy on the outer road. He literally just threw his water bottle out the window, empty water bottle. I watched him just go like this and I thought, what's crazy, I remember when I was a kid, it was all about don't litter, don't litter, don't litter. It was a big movement when I was little because people just littered. And now it's like, I just can't believe anybody would do that now. It's like
Yeah.
unheard of. Okay. Well, my favorite season is fall right now. So I don't know what fall is like in the part of Texas you're in. So I have all these favorite foods, things about fall that I just love. I love the sunlight in fall. It's just a more golden sunlight in fall.
Yes.
It's beautiful. What is your favorite thing about I don't know, I guess a Texas fall. It's different than a Missouri
It's
fall.
gotten cooler. It's cool enough that you can spend a lot of time outside.
So you're
So it's
you're going
I
outside
still
more.
spend time outside when it's 100 degrees, but because I really like it and I feel good. And This summer was great. We rained all the time. It was really wonderful.
We
But the
did.
fall here
We
is lovely. The temperature is lovely. So being outside, eating outside, socializing outside is my favorite
Do you
part.
do like fire pits and things like that when you
Yeah,
said?
but it's still too hot for a fire pit here.
Oh, okay. See, we're kicking out the fire pits and then probably in the next week or two, like it just gets real crisp. I woke up this morning, it was like 50 degrees. My window was open.
Yeah, having the windows open.
Love the window. Okay, so windows open. Ah, it feels the best. I love it. Well, thank you for being here as
Thank you for
always.
inviting me, Stacy. I always love talking to you.
Well, that feeling is mutual. And thank you, listener, for tuning in. And I hope you make some decisions for your life, for your family's life, to be well, be better than y'all were yesterday. So thanks for joining us, and we'll see you guys next time. Thanks. Bye. This podcast would not be possible without the inspiration of my dad, Daniel Becker, and creative direction and editing from the very talented Jason and Dane Becker, Ben, Lydia, and Judah Walker. To stay connected and keep the conversation going, be sure to subscribe to our podcast and visit our website at asappathway.com. And please remember, the information in this podcast is for educational purposes only. It's not intended to be used as medical advice or to replace your healthcare provider's diagnosis or recommendations.